panelists are getting geared up, I see. And while they're doing that, I wanted to introduce them very quickly. And I'll start with Judge Marchman on my far left. Judge Sharon Marchman is a district court judge from the 4th Judicial District in Louisiana. She was made local history in 2000 when she became the first woman elected judge in her area. We worked very closely with Judge Marchman in judicial initiatives as well as building a model juvenile drug court in the 4th JDC. And I could go on about all these panelists, by the way, but we don't want to use up our whole 45 minutes doing that. To her right is Mr. Frank Nooner from Lafayette, Louisiana. Mr. Nooner is chief of the Louisiana Indigent Defender Board, and he's also a member of the Juvenile Justice Implementation Commission that's appointed by our legislature to oversee juvenile justice reform in Louisiana. I want to comment that Mr. Nooner was given a special award for his outstanding services after Katrina by the huge amount of public service he rendered to New Orleans, and we're very grateful for that. To his left is Mr. Sean Hamilton. Sean is the Assistant Secretary of the Office of Juvenile Justice in Louisiana, and he answers directly to Dr. Mary Livers, our Secretary. He has 20 years of experience in working with children and families, and most recently, before we were able to snag him from DC, he was the superintendent here of the Youth Rehabilitation Services. To his right is Mr. Andrew Shealy. We call him Andy. And Andy is from Ruston, Louisiana, which is in northern Louisiana, and he is the first assistant district attorney there. Andy is very heavily involved in our work with the Louisiana District Attorneys Association. He's on the Juvenile Justice Task Force. He's on the board of directors for the LDAA, and he's really been a champion in Louisiana for best practices, especially evidence-based practices. And while there are many other people that I would have loved to have at the podium, we were limited to 4. So these 4 outstanding people will represent our work in Louisiana in a way that I hope illustrates to you what we've been doing without going into a lot of detail. Before I start, I wanted to thank all of you for attending and listening to our Louisiana story, being the 3rd of the Models for Change states. I also want to thank the Foundation, Julia Stosh and Lori Garducki, and the board for supporting Louisiana as the 3rd state, your southern partner, and for sticking with us after Rita and Katrina, which was a very challenging situation. I also want to thank you from our stakeholders, from our grantees who can't be here, but especially on behalf of all the children and families in Louisiana who have definitely are in a better place because of Models for Change. The folks on my left represent different constituents, as you heard: judges, defenders, the JJIC, and policymakers, Juvenile Justice Administration, which we have local juvenile justice and state, and the DAs. And one of the reasons that I selected this group of folks is because this is how we have made things work in Louisiana and be so successful. And that is working with the different constituencies, building consensus within and without organizations, because true reform is brought about by a real philosophy change and by all the system players working in the community together and building consensus within and without. I was asked to give you a little backdrop of how Louisiana was selected, and then we'll go to our panelists. So let me take you back to a pre-Katrina time. Louisiana was sued by the Department of Justice in 1999 for very serious conditions in our then 5 juvenile prisons. There was a settlement agreement in the Middle District of Federal Court by Judge Pelizzola, who put everyone in a room together and said, work it out, and a consent decree came about. That really began, I think, reform in Louisiana, but it was institutional reform. The state partnered with LSU Health Sciences Center to develop best practices in the facilities for medical, dental, and mental health. The Office of OJJ was created and taken away from under the state, and they began developing a treatment-oriented model for rehabilitation, not punishment, in association with Annie Casey Foundation. We had a very powerful Supreme Court justice named Kitty Kimball, many of you know, who was our champion, who later became Chief Justice and has been a huge champion and made juvenile justice reform part of her platform. And we had a governor at that time, Governor Blanco, who I know the foundation worked with very closely, who had juvenile justice as her primary agenda. So although Katrina hit us, we had a good foundation in place. We were released from the settlement agreement in May of 2006, and I've learned across the state that only happened because of a true change in philosophy and hard work within our community, because you can't make that kind of change over 5 years with a real philosophy change. So the political background, Katrina hit, Rita followed closely on its heels, and our whole state has really been in a transition since then. Our census has changed. We know this now by the new census that came out. New Orleans is not the biggest place anymore, which Baton Rouge is really where I live now. We began to see cracks in the system, cracks in funding. These two hurricanes really exposed some of the main areas of concern in Louisiana, which gave us an opportunity to come in and help. It changed our priorities too. The other thing that came about, which was very important politically, is term limits were called for in Louisiana many years ago, but they hit about a year or two after Katrina and Rita. And so all the historical knowledge that happened with the juvenile justice lawsuit, the trips to Missouri, the therapeutic model, really we had to start over in educating our legislators, which is a huge resource that Models for Change has given us. But in spite of all that, and because of all of that, I think, and the stake that we all had in it, in philosophy change and reform, Louisiana was picked in 2005 to be the third of the fourth Models for Change states. And we formally began in 2006 in February with a formal partnership between the Board of Regents, which is our Board of Higher Education, and Louisiana State University System. And I want to point this out as the strength of Louisiana has been its long partnership with academics and the public. It's been done for a very long time. We have a public health system, and that really works in Louisiana, and I think some of our panelists will mention that today. We focused on 3 TIAs, alternatives to formal processing and incarceration. Nobody wanted to do that anymore. Evidence-based practice in the community. They got a taste of what it was like to have good services in a facility, and folks wanted those in the community so kids didn't have to go to institutions to get that. And disproportionate minority contact, and looking at our youth of color and how they penetrate the system. We threw in an extra one, and that was creation of a juvenile indigent defense system. Believe it or not, when Models for Change started in Louisiana, we did not have a juvenile indigent defense system or a chief juvenile defender, and Mr. Nooner will talk a little bit about that. So we started. The lead entity was created, and we developed strategies for statewide success by linking local JDC work and key concepts of each of these TIAs with our state partners. We have engaged a diverse group of stakeholders, I can assure you, on the ground, and created a platform of common experiences and sharing those experiences between judges, defenders, prosecutors, local and state administrators, advocates, and providers. And this was an important strategy in Louisiana because we have a very diverse and unique justice system. Mr. Nooner, you came into this work on the heels of Katrina. Can you take a moment to explain our Louisiana uniqueness as far as the justice system goes?
Yes, I got involved in this in 2005 when I was state bar president, and New Orleans at that time was basically shut down, and as a result there was no funding for the criminal justice system on the defense side because it was totally funded by traffic tickets. And if you remember the pictures of New Orleans in August of 2005, there wasn't a lot of traffic, much less policemen to write tickets. So prior to August of 2007, almost 100% of indigent defense, public defense money was through local fines and fees. In 2007, we were able to pass Act 307 and create a statewide system of regulation. And at that point, the state started putting general funds into the system. And now it's about 60% traffic tickets and 40% statewide funding, and different jurisdictions have different amounts because some jurisdictions like Judge Marshman's is very good about raising money locally and they have a better funded system than say New Orleans, where It's an expensive system, and the judges are not quite as cooperative as Judge Marshman and her colleagues. That's why we have a lawsuit pending against the traffic court judges in New Orleans. So I don't drive in New Orleans, I take cabs. But you know, it's one of the unique things about Louisiana. The judges are elected, the DA's elected, the public defenders are selected by my board. My board's appointed by a diverse group. I'm appointed by the governor. There's one other board member that's appointed by the governor, and then we have 2 by the Supreme Court, each of the law schools, and the Senate, and the House, and the Lewis Martinet Society. So it's a pretty diverse board. The DAs think that we have a secret hidden agenda and that we're all communists and seeking the overthrow of the government, but that's, you know, that's not the case.
But
tell
we will
tell
the
them.
same panel.
Yeah, that's, you know, but we are actually, or as we speak, we're trying to work with the DAs to find some common ground, because there's just not enough money. Like most states, there's not enough money for the criminal justice system, in particular the indigent defense part of the system. But prior to 2007, we had no statewide system that regulated indigent defense, and we had no statewide system of juvenile defense in particular. And that's changed. It hasn't changed as much as I would like to see it change, but that has changed, that we do now have a statewide system. The other thing I think that's unique to Louisiana, and maybe other states have this issue, you know, juveniles can be adjudicated in city court, in municipal court, in district court, and in Baton Rouge and New Orleans in special juvenile courts. But those are the only sites that have special juvenile courts. So it's, you know, when you start meeting statewide, everybody's got a little bit different problem, and a different judge necessarily may be adjudicating the juveniles. So that's been a challenge to us.
Thank you. That's very helpful to give the folks a flavor of how Louisiana works and the multiple people that are involved. In talking to our panelists, one of the questions I asked him were, what do you think were one of the key challenges along the way? And most every single one of them said the same thing, and that has been a true change of philosophy across the judiciary, prosecutors, and defenders, and also treat the folks on the ground, line staff. Judge Marchman, I know that you felt strongly about this need for a change in philosophy, and any thoughts about why that was a key challenge and how that was addressed?
Well, in Louisiana, and probably in many other states, the viewpoint of juvenile work was that it wasn't that important. It was the training ground for judges, for DAs, for prosecutors, and the idea was send them to juvenile because they really can't mess anything up there. And fortunately, that viewpoint is shifting, where there's now an understanding of a need to specialize in juvenile work, and certainly an understanding for a high level of training that is needed. So we're still working on that aspect, and you know, we will continue to work on this, I think, for years to come. We're raising the level of awareness. We've been very fortunate, as Deb mentioned, to have a Supreme Court justice who ultimately became the Chief Justice, who had this as one of her initiatives. And when your Supreme Court justice says this is important, it causes everybody else to sit up a little bit and pay attention and begin to understand the need for the education and training. Another thing that we've done that we were lacking previously is to focus on the leadership aspect. When your Chief Justice says this is important and demands that all the other judges rise up in leadership positions, not only at the local level, but also regionally, statewide, and ultimately to the national level, those things become important as well. But leadership was something that was missing from the judiciary and the reform efforts until Justice Kimball became involved. Another key area that promoted our lack of understanding or awareness of why this work was so important is the mindset that services needed to be accessed through the court system. And in the judiciary, in our local communities, everybody looked to the judiciary to access services. And now we've tried to change that perception as well and push back to a place where the services really need to be delivered. You also, when you're talking about justice systems, we as lawyers and judges, we think that any program is a good program. If you have a program, it's got to be good. We're trying to help kids. And we have definitely changed that outlook and that philosophy. And I think that's key, along with leadership and awareness and education and training. All of those things you have to understand. And remember, we're not doctors, we're lawyers. So doctors understand the concept of appropriate services based on needs. And now we in the justice system have a much better understanding of that concept as well.
Do you think we've moved from a punitive model to a rehabilitative model, looking back at the last 10 years with a settlement agreement?
Oh, absolutely. We still have pockets and individual judges, perhaps, and communities that believe in a punitive model, but I think we've come a long way toward a therapeutic model, but an appropriate therapeutic model, again, as the court not being the place to access all of the services. We traditionally, even in our adult system, many of our people, and we live in the poorest part of the country, many of our people, the only way they could access service was by going to jail. And our judges now understand that's not the right way to treat them. We have to push back and connect them with the services in an appropriate way.
Do you feel that our consensus building activities have helped with the philosophy change?
Absolutely. You have to attack this problem from every angle. It started with us at the top with the Chief Justice, but we've worked every single association of judges, even though we're reaching out to even those who don't do juvenile work per se, with an understanding of how this work affects all of the work that we ultimately do. All the various associations, from the district attorneys group to the different judges association to community groups and regional groups, you have to reach all of them and work on building those relationships. That takes a lot of time and effort, and that's something that judges have not always been traditionally engaged in because we have a docket. So you have to remember your docket comes first, but the judge is the leader in all of the collaborative efforts that go on. We've done a great job in Louisiana with the drug court model, and so we had a foundation to build on, and it's very similar the way you work the collaborative effort. So I think we've made great progress in the juvenile area as well.
Thank you, Judge Marchman. One thing I would mention on behalf of all of us that's been a challenge in Louisiana is that we do have a very high poverty rate. And that forces people into some of our systems at a higher rate, unfortunately, than other states have to deal with. But moving forward and thinking about what has changed in Louisiana in the last 5 to 6 years since Louisiana has been a part of our fabric, I will tell you the local pilot sites, the local grant sites have done the work on the ground. And I can't give enough recognition to those people or name all of them, but many of them are in the room right now. And on the backs of the local reform, that had to happen first. As all these folks can tell you, if it doesn't happen on the ground and you don't have judges and DAs and defenders saying, hey, this really works, it doesn't get much traction. So first, the local work happened. And then we began building partnerships that became the platform for future reform between our local sites and at the state level. Louisiana developed some key state partners along the way, the Supreme Court being one of them that oversees all the juvenile drug courts and our status offender programs. We also work closely with the Children's Cabinet in developing model children and youth planning boards, which were unfunded mandates to bring a lot of folks in the community together to talk about their children and their community. And Judge Marchman and I would agree that was a key area of consensus building that MacArthur helped with. Another state agency that we worked very closely with, obviously, is the Office of Juvenile Justice. And I'd like to ask Mr. Hamilton, who's Assistant Secretary for OJJ, What have you seen change over the last 6 years? What do you think you have been your key reform areas that you'd like to share today on behalf of the state?
Gosh, so much has changed over the past, I guess, 5, 6, or 7 years. When we look back to 2005, we were actually a part of a settlement agreement. And it was around that time that 2 of our facilities actually were found to be in compliance with that settlement agreement. And then around May of 2006, the settlement agreement, we were actually released from that, and the settlement agreement was dismissed. Also around that time, probably in about 2005, we really started focusing on our strategic plan and actually publishing that strategic plan. Some of the areas of focus were to really focus on and look at safety issues in our facilities, to talk about and really focus on and look at family involvement, community involvement, a continuum of care, and also how we used and looked at data sources. We really started focusing very heavily on our treatment model. Of course, I think everyone knows that we partnered with the Missouri Youth Services Institute. We got a lot of support from the Casey Foundation to help us further and better that effort. We realized that we needed to really look at reducing the number of kids that we were serving in our secure care facilities, and we recognized that many of those kids could actually be served in the community where they could be connected to their families and to resources within their communities. We started having a lot of conversation and discussion about regionalization. And since that time, actually, we have just this year, this summer, we've divided our services around the state into three different regions. One region that serves the northern part of the state, another region that serves the central, southwest part of the state, and then the third region actually serves the metropolitan New Orleans area or the southeast part of the state. And then, of course, we've constantly been challenged with trying to find new and innovative ways to continue to make all of this happen with dwindling resources, which has been a huge challenge for us in looking at how can we continue to meet the needs of our kids and families with fewer resources. So I think over the last few years, we've seen a lot of progress in what we've been doing at OJJ.
A few of the things Louisiana Models for Change has been partnered with OJJ is the development of their juvenile justice indicators and providing better data to staff and the judiciary. Probation models. The SAVORY was implemented statewide after local pilots. It's a best practice post-adjudication assessment tool that I think has been very helpful in your keeping kids out of secure care. Would you agree with that, Sean?
Yeah, yes, I would. When we started using the SAVORY, it really helped us to be able to zero in on what type of treatment kids really need and to have better classifications for kids. Also, when we looked at the use of evidence-based practices, that has been very helpful to us. In actually meeting the needs of our kids. We've worked very closely, most recently, with Dr. Ed Latessa and the University of Cincinnati to really focus on criminogenic thinking with our kids and really target that as an area to really help and improve a lot of the behaviors and stuff with our kids.
Thank you. So one strategy was working with our state partners. The next strategy that we used in Louisiana was really partnering with our Louisiana professional organizations. After developing buy-in on the ground from local judges and defenders and DAs and providers and JJ administrators, we reached out to the Juvenile and Family Court Judges Association, led by Judge Cook, who's here today, the District Court Association, led by Sharon Marchman at the time. She's past president now. The Louisiana Defender System, led by Frank Nooner, and then the Louisiana District Attorneys Association, led by Pete Adams. And I'd like Mr. Shealy, if you don't mind, to talk a little bit about why it's so important to partner with our professional organizations and how that provided the ability to adopt best practices, disseminate models, and train your constituents.
Probably the most important thing that I think the MacArthur Foundation has done since it got to Louisiana was build this network of people. And I have to commend the foundation on the fact that they never got too far out in front of any of the organizations. I think that they brought us all along slowly and steadily. As Dr. Garducki said, system change is a journey, and this has been a journey. But I think that building these coalitions, and as Mr. Nooner indicated, the DAs and the indigent defenders may many times disagree, but I think in the area of juvenile justice, more often than not, they agree than they disagree. So I think that was very, very important. And I think that the other thing that I think was important is that no constituency group was demonized in this, and everybody was encouraged to join together. And I think that's the biggest secret to the success in Louisiana is the approach that the MacArthur Foundation used in bringing all of those diverse groups together. And believe me, they are diverse. They don't always agree, but I think more often than not, we're finding that there is agreement now that there's been better education of all of those different entities.
And you're acting very nicely today. I want to thank you for that. It's not acting. They all know each other now. Part of it was building relationships. One thing I'd mention about the LDAA, just to give you an example, they developed model DA diversion guidelines for juveniles, which had never been done. And as Mr. Shealy would tell you, while the DAs all agreed on it, having guidelines for the foot soldiers like him that were approved really helped. Best practice training for people specializing in juvenile, like Judge Marchman said, no longer is it okay that we're a stepping stone to adult. DA diversion programs that were created on the ground, and they formed a juvenile justice task force within the LDAA to really concentrate on all these activities, and that's become a permanent fixture, and I assure you will not go away after Models for Change. So partnering with our professional organizations, as you can see, has been a key activity. But we couldn't do that without the champions up here believing in this, I assure you. The other partnerships that I wanted to highlight was the partnership with higher education. We really saw in Louisiana, we have a college or a university on every corner, I'm not kidding, and we really wanted to use those places to provide data collection, partner with courts for clinical programs, education and training. And I know Judge Marchman feels very passionately about this and would like to give us a little more detail on why that's so important in Louisiana.
Okay, you just tell me when I have to stop talking about this, because I do get really excited about this. As Deb said earlier, our state has a very long and strong history of public health, and that's through our university systems. We do have a university on every corner. I have 3 within 30 miles of me. That's a lot. And so it just makes sense to have that partnership. All of the things that universities do well, the justice system does not do well. What we're really talking about here is research. And the justice system really doesn't know anything about that type of research. And so that partnership has promoted data collection and analysis of the data, research for best practices, because we're recognizing that what we are doing today is not good enough tomorrow, because things change and we need to be on the cutting edge of that research. And our university system provides us with that. They're also good at grant writing, and the justice system is not good at that. And so they're plugging in those gaps that we need to fill. And talk about getting good services for very little money. Unbelievable. And the interns that we use are so highly supervised, and they know what they're doing. And it's just really great to be able to do some of the things that we couldn't afford to do in the private sector by utilizing interns and professors from our university. And they bring such a great level of excitement and energy and enthusiasm. When you're talking about young people who are, really just getting into what they want to do for the rest of their lives and devote their lives to, they bring a tremendous amount of energy that some of us old dogs in the legal system need sometimes, because you can really get in a rut with the work that you do day in, day out, and not seeing any success from it. So those are all benefits. Let me talk about law schools and law clinics. That's where it all starts. That is higher education. That's where we can start to bring in the concepts that we're talking about today. We need to quit training lawyers who did it the old way, who come out and become the defenders and the DAs and the judges and have the same old mindset. We have an opportunity with higher education to make those changes very early on, and I think that's key to sustainability. So can I have a few minutes to talk about, here's some of the things that I use my local universities for. I have a juvenile drug court. Our treatment in juvenile drug court is provided. Our local university has a marriage and family therapy clinic, which has a master's level and PhD level programs. We also have a separate substance abuse counseling center. So we use them to do our treatment there. Every organization that we have within our community, whether it be for domestic violence, mental health treatment, anything that can tap into using those interns, that's where they go, which gives us a very broad base of referral agencies for services. We also use them to collect data, analyze data. They do surveys for us. We've used them for video production. They do our juror video for the court system, and we are working right now on a video of graduates out of the juvenile drug court to play in our waiting room while kids and their parents are out there waiting to come into court. We have a TV screen, just like when you go to the doctor's office and they give you all that good information on the closed circuit TV. They can get that information directly from the clients themselves, which is a tremendous opportunity for them. We couldn't afford to do those things. Okay.
See, I knew I picked the right person to talk about this.
I have more on my list. See me afterwards.
One thing I do want to highlight that Judge Marchman mentioned, and this was totally in partnership with the MacArthur Foundation, a best practice juvenile defense clinic was started at LSU Law Center. The first of its kind there. It is so successful now. The person who was our coordinator was hired as full-time faculty. They have a waiting list for the clinic. And as Mr. Nooner will tell you, it's a feeder for the system. It's feeding us much better prosecutors and defenders, and has been a great illustration of the partnership with higher education and why it's so important in Louisiana. I also want to mention our partnership with our Louisiana advocacy organizations like the Children's Coalition of Northeast Louisiana and JJPL. Dana Kaplan would be here, but she's running for New Orleans City Council, which is a next week election, so we wish her luck in that. But they have kept us, ensured us with the important principles and of legal advocacy throughout all our work and our partners in everything we do. Switching gears for the last 10 minutes so long term, where do we want to go from here? I can assure you that Louisiana desires to sustain our reform and keep going by replicating all these successful models and creating more statewide reform. Clearly, we have very passionate leaders. These are just a few. We have many, many more like these people, and we're very blessed with that. I can tell you that one of the areas that we all feel strongly about that we'd like to see further developed is on evidence-based practices. We've been very successful in this area over the last 5 years, believe it or not. If you attend a session tomorrow on evidence-based practices that I'm giving, you're going to find out that we are number 4 in the nation in growth among all 50 states over the last 5 years in juvenile justice evidence-based practices. Give a shout out to Mr. Peter Greenwood, who's here and going to be talking about that tomorrow. But we feel it's not enough and we want more. And Mr. Shealy, I know that as a DA, you have become very interested in evidence-based practices. One of the strategies we've used for this is really having defenders, judges, and DAs understand the right services for the right kids at the right time. And they are the referral source. So once you really have that understanding that you want a medicine that treats the problem of the kid, so to speak, people really get that. And people are advocating for more evidence-based services in the community, not in institutions. How important, and tell us a little bit about why that's so important, Mr. Shealy, over the next 5 years of our next set of reforms.
I think one of the reasons it's important is that in Louisiana, prosecutors are a little bit different than in many other states because they have sole control over all the prosecutions. They're local. They don't report to the Attorney General, for instance, or anyone else. And as a result, I think that along with greater authority goes greater opportunity, and the prosecutors have used that greater opportunity to create intervention programs such as truancy assessment service center programs, prosecutor early intervention programs, and their diversion programs. One of the major shifts to us was to it be drilled into us the use of evidence-based practices in the assessment of the children who come into those early intervention programs. Not only a good assessment, but also good outcomes with the services that we provide. So as a result, I think that most of those who are operating those early intervention programs are now using evidence-based assessment tools, such as Savory or CANS or the NCART, and also now we're using more and more evidence-based services such as MST or FFT and other things such as that, and we're using them in those early intervention programs. We're hoping to keep those kids out of the deep end. So I think evidence-based practices are very, very important, and education of all of us who are within the system on what those best practices are, when there's proper to use them. And the other thing that I think is going to be important as we go forward and as we're developing a system of responses to youth is that we have to build models that have rapid interventions. We have to build models that have consistent services, and then finally effective services, and that's exactly what evidence-based practices are. And so I think that's why it's so very important that we build upon what's happened so far. We're fortunate to have Dr. Stephen Philippi in Louisiana that's really helped guide us toward evidence-based practices, and he was kind of the first one that even let me know there was such a thing as evidence-based practices. So I think that's going to be very important in the future.
Mr. Hamilton, in a minute or two, I know that all of us are very supportive of the continued development of the OJJ therapeutic model. Is that your vision over the next 5 years? And in a nutshell, what are your things that you would like to accomplish in that regard?
Yeah, I guess when I think about the opportunity we have to really meet the needs of young people, when you think on the fact that we are a correctional facility, I mean, this is juvenile justice, and we are providing a therapeutic model that meets the broad spectrum of needs for our kids as it relates to their mental health, their education, their medical needs, behavioral needs. That is really, really profound to me, and we have such a small window of time to actually do that. When we look at how we collect and use data to focus on policy and practice, and data can also help us focus a little more on the types of treatment interventions that we use. That is something I think that is really huge. When we talk about our probation model, where our probation officers are with our kids from the time they enter the system, throughout their time with us, and even when they exit the system and they're reintegrated back into the community, and we're there to support them and to help keep them out of the system from coming back into secure care. I just think it's huge. So we are going to continue our efforts in implementing this reform and implementing our treatment model, because it's working, and we're getting a lot of positive outcomes from doing so.
And one thing I can tell you about the therapeutic model, while the recession has set us back a little, all of us haven't done what we wanted to do. Everyone at this dais is 100% supportive of that and are doing everything they can. And I'd like to really focus my last and final question on our JJIC member, since he's going to switch hats from being an IDB attorney. Mr. Nooner sits on the Juvenile Justice Implementation Committee, which oversees all juvenile justice reform. And about a year and a half ago, the JJIC commissioned us, the Institute for Public Health and Justice, with funding from the MacArthur Foundation to look at what have we done over the last 5 to 6 years? What accomplishments have we made? What can we say about our kids? Where are they? Where are our services now? Where are we with our data capacity? And where do we want to go from here? They will be getting that report the end of December, and it'll go public in January and go to the legislature. But as part of that, we had 3 consensus building meetings to kind of look at the recommendations and the priority areas going forward. And Mr. Nooner, Judge Marchman attended those. They were very well attended, and we know now there's a lot of areas of consensus. It's just a matter of choosing which one. Mr. Nooner, how would you like to see this play a role in the future? And what, as a JJIC member, what do you think a future reform looks like in Louisiana?
You know, I think the future is bright. Touching on what Judge Marshman said about the law clinic at LSU, that's just been fantastic. Not only for my university to have a law clinic finally, but also to educate these students in juvenile law, because we don't have that resource in Louisiana. We don't, at the state level, we're looking for a chief juvenile defender and a deputy right now, and we just don't have many applicants. Taking that to JJIC, it's the same thing. JJIC was created really after the legislation to oversee the implementation, and our lieutenant governor at the time, Mayor Landrieu of New Orleans now, was very focused on that. Well, when he left, we lost some of that focus. We still had Justice Kimball, but now she's leaving. And what I've seen in the year and a half I've been on JJIC is we don't have that continuity, just the way it's set up. We have no dedicated staff for JJIC. And I'd like to see us develop a dedicated staff so that as the people change, as people roll off and come on, we have the continuity of the staff. And I think that's something that we're looking for funding for to create a staff, because right now it's staffed by legislative staffers, 1 year by House staffers, the next year by Senate staffers, depending on whether a senator or a representative is the chair. And that doesn't give us the continuity of staff that we need to be able to advocate for changes in the system, to oversee needed legislation, to try and build consensus. This consensus building meetings that we had around the state, these 3, I went to the one in Lafayette, and I don't practice juvenile law, I don't practice criminal law, but I could sit there between the DA and the judges and the local defenders in my area and see how much common ground they had, and bring, just the fact that we were able to bring them together. They were, 95% of what they discussed, they were on the same page, they were agreeing. And this is juxtaposed against my good friend who's a juvenile judge, who used to call me every month berating my defenders because they were taking writs on him or he didn't like what they were doing. But he has now bought in, and as Dr. DePreto will tell you, he's one of the big advocates of what we're trying to do in Louisiana now, but originally he resisted change. So, the fact these consensus building meetings, I'd like to see that continue if we could have the funding mechanism. MacArthur funded the 3 that we had, but if we could do that once a year or at least every 2 years to bring everybody together, I think that would really be something that could sustain change and help to sustain change in Louisiana.
So, as Mr. Nooner noted, one of the key areas of consensus was the continuation of being able to have a site for best practices, for data collection, and for providing these types of continuity with the JJIC. So hopefully that will come to fruition over the next 6 months, and we can that's a key area of reform I think we would all like to see. In closing, I want to give a shout out that we have 4 breakout sessions over the next couple of days. If you want to hear more about what we're doing, Judge Marchman and others will be at a judicial leadership later this afternoon. We're doing an evidence-based practice presentation. Our champion is going to be talking about a higher ed model for career development pathways for kids and getting our kids successful in local community colleges, and our reforming probation model from Jefferson Parish. So we welcome you to hear more about what we're doing or pull us aside. What I'd really like to do now as I close is to ask the entire Louisiana delegation to stand up so we can give a shout out to all of you. And we appreciate everyone's participation in making Louisiana successful.